Hello, Professor. Jason Wang, today's reporter. My advisor is Dr. Semin Yi. Today I will talk about apolipoprotein C3 rich LDL is evaluated in CKD patients and induced endothelial cell apoptosis. This is my outline. First, I will introduce my research motivation. Second, I will introduce our study aim and review our results. Fourth, discussion and conclusion. Fifth, reference. Our research motivation in Taiwan: 1 in 14 people suffering from CKD. In CKD patients, female and male both increase more than 15% in CVD. What makes CKD a risk factor for the incidence of CVD? This is our research motivation. As we know, CKD accelerates leading to CVD. And in CVD, atherosclerosis is the domain cause. And in the cell opportunity, endothelial cell apoptosis play a major role in the atherosclerosis. In the dyslipidemia and combined with oxidative stress. In endothelial cell and atherosclerosis, apolipoprotein C3 rich LDL may play a crucial role. It causes endothelial cell damage, causing the lipid from artery lumen moving to the intima, cause the macrophage to form foam cells. The foam cell will accumulate in the lipid necrotic core, which form atherosomers. This is the cause of CVD. So endothelial cells apoptosis is a major risk factor for the development of atherosclerosis. And isocyanates may play a crucial role in the progression in endothelial cell apoptosis. Let me introduce apolipoprotein C3 first. Apolipoprotein C3, also called ApoC3, is excreted by the liver and the intestine. It majorly appears on TG-rich lipoprotein. Apolipoprotein C3 can inhibit activation of lipoprotein lipase. Generally, ApoC3 is contained in VLO, DLO, and HDL. However, in patients, acylcyanaide is found in LDL. So we collect human blood from CKD patients and use ultracentrifuge to separate the serum and the blood cells. We further subfraction the LDL using affinity purified antibody, which called anti-human ApoC3, to separate the LDL to acylcyl negative LDL and the acylcyl positive LDL. We use the Western blot to show that acylcyanaide expression is indeed in CKD patient, and compared to the normal patient, the CKD patient had increased acylcyanaide. We further incubated the acylcyanaide with human LT endothelial cells to see the morphology of the HIC. Second part, and we try to find out acylcyanaide-induced endothelial cell apoptosis by increasing intracellular oxidative stress and its underlying mechanism. First, whether acylcyanaide-induced intracellular oxidative stress and cause endothelial cells apoptosis. Second, which pathway does AC-SON allele induce endothelial cells apoptosis? Third, is AC-SON allele increased in CKD animal model which had severe atherosclerosis? Part 3, our result. AC-SON allele increase cell death, which cause cell viability decrease, and increase intracellular oxidative stress. In a host and cancer AM stain, which shows cell apoptosis increase and increased DNA damage. The AC-SON allele causes oxidative stress to rise, inducing endothelial cell apoptosis. We further use Western blot to see which pathway does AC-SON allele induce endothelial apoptosis. We found the phospho-IKK alpha P15-3 and the cadif-caspase-3 pathway is responsible for the endothelial cell apoptosis. We can see when we add AC-SON allele into the endothelial cells, the phospho-IKK alpha P15-3 and cadif-caspase-3 increase. We also use SIKK alpha to validate our thinking. The P15-3 cadif-caspase-3 is decreased by the Western blot, and the cell viability is increased, and the RS level is decreased. So, above data show that AC-SON allele induce endothelial cell apoptosis via the IKK alpha P15-3 and the caspase-3 pathway. And the SIKK alpha can diminish cell intracellular ROS and apoptosis. And we use B6 mice model to prepare our animal model. We first tie its